My name is Pamela Ford and I am the archivist at the Royal College of Physicians of London. I look after all of our old books and manuscripts here in our London building, including the item we're here to talk about today. It's a handwritten manuscript from our archives. So we're taking part in the MROC 2022 Transcribathon in November this year. As part of that, we're putting in one of our manuscripts, a handwritten medical recipe book from the 17th century, and it's right here beside me. So, when reading this volume, or indeed any other domestic medical manual, you have to really think outside the box in terms of what is considered a disease. You will notice that in these volumes, they treat symptoms as diseases in some cases. So, for example, there are recipes for pain. Pain is a symptom, not a disease, but they don't really distinguish between diseases and symptoms in the same way we do. It's not quite as strictly organized. So, for example, even with a very organized alphabetical index, the name of something, the name of a disease, the name of an ailment may not be what's put down as the reason for it being in that section. It could be the source of the recipe, a particular doctor. It could be one of the symptoms of a disease. So you have to think flexibly in terms of what you consider a disease when reading these volumes, because they look at symptoms as equally important as the underlying conditions, because in many cases they weren't aware of the connection between the symptoms and the underlying conditions. So many of the recipes also specifically deal with infection. Obviously, in a time without antibiotics, in a time when most people didn't wash regularly, and certainly didn't wash wounds as part of treating them, infection was a real and serious problem. So there are many, many remedies in the volume which talk about infection. So you will notice also that many of the domestic medical manuals talk a lot about purges and laxatives. So bloodletting, making someone sick, giving someone diarrhea. All of these lovely things were very much designed as part of a treatment regime which considered the body to be a balancing act between a set of core elements. And that's why they prescribed so many laxatives and purges and bloodletting cures. It all made perfect sense within the system. However, they had an issue when it came to infectious diseases, because that didn't fit within the four humours. So to come up with a way to deal with that, they introduced the concept of bad air. So the idea was that bad air or stale air actually caused these infectious diseases, because obviously it couldn't be the body not being in balance, because people were clearly infecting each other somehow. Hence why there were so many treatments which talked about using perfumes or strong smells, again, to try and stop the bad air, increasing the infection rate. Going on to talk about the ingredients in the recipes. Actually, many of the ingredients are easily sourced locally, which is a good indication that this was again used by a local healer rather than a doctor who would have charged a lot, because it's actually using products that people would have found easily in their daily lives. So there are a lot of plants in there. They use urine a lot, which is readily available in anywhere. They often used animal products in these recipes. So a very good example is snails are often a major ingredient in recipes designed to aid nutrition or to counter tuberculosis, which leads people to waste away. They use animal products such as lungs. So they think that if you feed someone a set of healthy animal lungs, that it will help their lungs. They also use deer horn, deer antler a lot. So antlers are a very good source of a number of minerals, and most species of British deer shed their antlers every year. So that was a very easily replenishable source of ingredients for a set of recipes. In addition to animal products, one of the main carriers they used for the ingredients and recipes was, not surprisingly, alcohol. They didn't often use water, or at least they didn't use water that wasn't boiled as part of the recipe. So actually these recipes would have been reasonably hygienic because they would have been mixed with alcohol or boiled water. So local plants, deer horn, there were a few exotic ingredients and minerals, but not many. So this all overwhelmingly gives an indication that this is a book for very practical local users. So overall, this is a very useful and practical manual, well organized, with a lot of recipes with good attributions and good instructions for use. Here are some general tips for transcribing, not just this volume, but any handwritten item that you come across in your research. Successful transcription of handwriting depends on two things: pattern recognition and knowledge of the context. Pattern recognition is important because people, when they're writing, use the same shapes to make the same letters and words, time after time after time. So the longer a piece of text you have in someone's handwriting, the easier it's going to be for you to identify the letters and the words and which shapes they use to form those letters and words. So that once you find a word that you can identify in a set of letters you can start building up the jigsaw puzzle and figuring out what shape the missing piece is supposed to be. Always very useful. The second element is context. If you have missing pieces, words that you just can't identify from the pattern, if you know the context in which the word is being used, then it's a much easier thing to do to figure out which word it's likely to be. So for example, if it's a title deed, they have very standard formats and use the same words over and over again. If it's someone's will, they will use a standard set of words. If it's a domestic medical manual, they will be talking about ingredients or instructions for use, or perhaps a doctor's name. So again, you have context in which to figure out what the really difficult to decipher words mean. So again, two things: pattern recognition and knowledge of the context. And if you use both those sets of skills, you will find transcribing anything much easier, including this volume.